location and the amount of amniotic fluid around the baby. They also determine your baby's due date. Cord marker screen. This is a blood test conducted between the 15th and 20th weeks to screen for problems in the development of the central nervous system, the brain, spinal cord and other tissues. Amniocentesis. This procedure tests the amniotic fluid for birth defects like sickle cell disease, cystic fibrosis, muscular dystrophy, Tay-Sachs disease or Down syndrome if the parents have a significant genetic risk. Chronic villus sampling, CVS. Cells from the placenta-uterus junction are also tested for birth defects during early pregnancy, especially if you have certain risk factors.
Okay, Dr. Dwedee, let's talk about the health risks, or just the risks both to the mother as well as the child, the baby, when you are pregnant in your 30s and 40s.
Let's begin with the maternal risk first.
Okay.
Not just for a pregnant lady, but anyone after the age of 35, medical conditions start to occur.
Right.
Yeah, like diabetes or raised blood pressure.
Okay.
So these start happening in any human being. And obviously a mother who is pregnant after 35 is more prone to have that. Then there's increased risk of having gestational diabetes.
Okay.
Increased risk of having pregnancy-induced hypertension or otherwise as well. The lady might already be, hypertensive by that time or diabetic by that time.
Okay.
Then there has been association of what is called placenta previa, that is the low-lying placenta, with increasing maternal age. Earlier, as I mentioned, there's increased risk of miscarriage.
Okay.
So, which leaves an emotional trauma.
Right.
So, these are certain things, and there has been also this observation. There is increased instrumental deliveries and cesarean sections in these mothers.
Okay.
Reason being that if there is any high risk factor during the pregnancy, obviously, and it's a precious child, so you end up having more of a intervention than the normal delivery.
Okay. And Mala, was your, because you can compare both your pregnancies, do you feel that there is any difference in the two pregnancies? This one's probably easier, right?
I mean, physically it's been good.
Okay.
I mean, one gets scared, that you're like, 6-7 years older and, it could.
Right.
But no, luckily for me, physically I've been fine.
Okay.
And emotionally, I mean, obviously I wanted it, so I'm really happy about that.
Right.
And one knows what you're getting into anyway because you've already done it, so I'm pretty good that way, I think.
Is the risk factor for the baby also higher, or is it more for the mother carrying the baby?
It is both for mother and baby. That is why we are in fact discussing this, because it is a special category. There is increased risk for mother as well as baby, but it is not that is an absolute risk, and lady should not think getting pregnant after 35. Right. It's not so. It just needs closer monitoring, more frequent visits maybe to your gynecologist. But that is it. It's nothing to be, panicky about.
Okay, a lot of wonderful information. With that, we'll take a very short break. Do stay with us. Welcome back. Today we're talking about getting pregnant in your mid-30s and 40s and what you need to know in order to have a happy and healthy pregnancy. I'm at In Living in Chhatarpur, and joining me now is Madhumita Puri. Hi, Dr. Puri. Thank you so much for being here.
Thank you.
And Dr. Puri is a psychologist. Also here today is Mala. Hi, Mala.
Hi.
Thanks again for being here.
My pleasure.
And joining me here today is Supriya. Hi, Supriya.
Hi.
Thank you again for being here.
My pleasure.
Before we continue, let's ask some people what they think are some of the pros and cons of having babies later on.
I don't think age can be the only factor about deciding that whether it is a disadvantage or advantage. It is when you are mentally prepared for it, then it's okay. You can have, if you are prepared at the age of 25, 26, then it's okay. Otherwise, you think you are more settled and prepared and ready to marry or have children at the age of 35, then it's okay also. But yes, medically it will be a bit difficult, but I think it anybody's personal choice.
Yeah, it has many disadvantages because when the child grows up, the father becomes very old. It attains the age of 60 when he is also 25.
No advantages or disadvantages. I think it's just a choice of life and it should be respected.
35 के बाद तो बच्चे अवॉइड ही करनी चाहिए, इससे पहले ही ठीक है. कम से कम ये तो है, बच्चों के साथ साथ एज ठीक रहती है। बाद में तो ये होता है कि 40 के बाद तो तुम स्कूलों में जा रहे हो, पता है कि 5 साल का बच्चा उसके साथ स्कूल में जा रहे हो, 40 साल के तुम हो गए हो।
Depends, like most of the girls these days want to work and want to have children later once they're settled, you know, in life, and they know for sure that they can raise a child. So if a parent is mature enough to look after the child, I think it's advantageous. To have too early also and not to be able to look after the child and bring them up probably would not be so advantageous.
Advantage or disadvantage का मालूम, लेकिन child should be मतलब जल्दी होना चाहिए, before 30.
I think it's disadvantages. Because I think parents tend to lose patience by that time. They're not as patient as they are in their younger ages and more active at that age to take care of their children properly.
I don't have kids, so I think you can have kids at any age. They may keep you young.
Okay, Supriya, let's talk about some of the pros and cons from your perspective of you having a baby now.
Okay, apart from the physical aspects and certainly being on a higher risk for certain things,
right?
I think everything else is very much a pro.
Okay.
And I'm at a stage now where I have absolutely no conflict in terms of my career versus a domestic life.
Right.
You know, I worked for 17 years in HR.
Okay.
I'm an MBA. I've worked in the best of multinationals. I've traveled. I've, you know, just done everything 100%.
Okay.
And so, you know, there's been a very sort of focused career for a certain number of years. And so now I'm actually looking forward to, I'm on a break right now.
Okay.
I'm not working.
Okay.
And so yes, it's late. So the physical part is, you know, it's an anxious pregnancy.
Okay.
That's not a pro. You know, you're supposed to be very happy and very relaxed.
Right.
I keep thinking about the next test and the next test, and you know, every milestone. So now I'm in my last trimester, and there's still, you know, things
that you need to go through.
Yeah, it's not that I'm still breathing easy.
Right.
But the rest of it, career point of view, financial point of view, willingness to stay home and not missing action and
missing the action, yes,
not
absolutely.
missing partying on weekends, and you know, you're very ready for a few years of that. So that's a big pro.
Okay, so let me ask you, what is the best thing that you've been enjoying so far about your pregnancy?
The best thing is that this is the first time in my life I'm staying at home.
Okay, so
you know, I've either studied or worked.
Okay, and Mala, with you, what do you think are some of the pros and cons of being pregnant this second time around?
I think the con would be basically the age difference now that my children will have.
Okay.
Can't call it a con, but it's like, you know, it goes through my mind that you know, will they get along and will they be able to do things together.